Knock, knock, knock. Hi, my name's Crystal. I'm a student nurse. I'm going to shut the curtain for privacy. Today I've got orders for an IV Piggyback for Cefazole. Can I have your name and date of birth?
Joe Smith, 10-5-53.
Joe, do you have any allergies?
Sulfa.
Okay, there's no sulfa in the things that we are going to use today. Making sure I do have an active order, Cefazole 1 gram over 8 hours for pneumonia. So I'm going to wash my hands. And I don't need gloves right away, but I will later. So I'm looking at the arm and I'm looking for signs of phlebitis, which would be sore, tenderness, redness around the IV, which I don't see. And then I'm also looking for signs of infiltration throughout the arm, and that would be pooling around the IV port and then underneath the arm. So then I'm going to tell you a little bit about Cefazole. Cefazole sodium, Anzoff, which is the safe dose is 150 milligrams to 1.5 milligrams or mgs every 6 to 8 hours. The indications are treatment of serious infection of bone, joint, skin, soft tissue, respiratory tract, biliary tract, and GU tract. Dilution is 50 to 100 milligrams. Rate of admission is 1 mg over 3 to 5 minutes. Precautions are hypersensitivity reactions. You need to be careful with patients who have impaired renal functions, allergies, or history of GI disease. And then with patients that have impaired renal function that have high doses of this, you want to watch for seizures because they can occur. Side effects are anorexia, CDAD, diarrhea, increased bun and creatine levels, hypersensitivity, and there's no antidote, but you would want to notify a physician right away when you see side effects and discontinue the drug immediately. So then I am doing my first check against the MAR, Cefazole 1 gram, Cefazole 1 gram over 8 hours, and then I'm doing my math, which is 10 milligrams over 40 minutes with a drape rate of 10 drops per minute, and then that equals 12.5 drops per minute. And you want to divide that by 4, and that's 3 drops per 15 seconds. So then I am doing my second check, looking at the bag to make sure there's just no signs of discoloration. Everything is still intact, it's not leaking. And I've got Cefazole 1 gram, Cefazole 1 gram, and then I'm doing my 5 rates: right patient, right medication, right dose, right route, right time. And then I'm doing my third check against MR, and I've got Cefazole 1 gram, Cefazole 1 gram, and I'm putting my gloves on. So then I am looking for intactness of my bag, of my tubing, and the expiration date, and it's not expired and everything is still intact, no holes. So then I'm going to open that up. I'm going to take out my extension. Hang it up. And then I'm going to spike my bag. From the thumb. And then I'm going to go ahead and hang up my secondary bag. I'm going to close my clamps. To do this, I'm going to disinfect my port for 30 seconds. In 30 seconds, I'm going to undo this, maintain sterility. I'm going to prime my lines, making sure there's no air, kinks in it. So I'm going to open this. So then then normally this should be just halfway full. Shouldn't be. I didn't clamp my bag right away, so it filled up. So then I would prime. So then I'm going to do my drip right. So I want 3 drops per 15 seconds. Make sure this is open. All the way. So 1, 2, 3, just in case again. 1, okay. So then I would label my tubing with my name, my initials, my date, and my time. Along with my tubing, I would label it with my initials, my date, and my time. And then I'm going to walk you through about how to shake an IV port out. And so at first, I would put a pad underneath the IV port, or where the IV is, and then I would wash my hands for one and put new gloves on. And then I would put a 2x2 gauze on the IV and slowly remove it and not applying any pressure. And then once the IV port is out, I would apply pressure for 1 to 3 minutes and then change that gauze to a different 2x2, put tape around it so it applies pressure. And then is there anything else that I can do for you today, Joe?
No, thank you.
All right, and then I would document.